Hi everyone, welcome to an NRCDV Training Institute webinar. I'm Marcy Tate-Lamar and I'm so glad that you're joining us today for part 3 of our Enhancing Services to Male Survivors webinar. During this training, you're going to hear about how to competently serve male survivors of domestic violence and create more gender inclusive services. Let's get started. All right, good afternoon, everyone. Thank you so much for joining us today, and welcome to our webinar on enhancing services to male identified survivors, part of our Male Identified Survivors series.
Buenas tardes a todos, bienvenidos a nuestro seminario de mejorando los servicios para sobrevivientes que se identifican como hombres, esta serie de defensoría y sobrevivientes varones.
Thank you so much to our interpreters today. So our webinar today is brought to you in collaboration with the team of the National LGBTQ Institute on Intimate Partner Violence. This is a project of the National Resource Center on Domestic Violence. If this is the first time that you've joined one of NRCDV's Training Institute webinars, we'd love to welcome you and suggest for you to visit our website and follow us on social media so that you can learn about the exciting upcoming projects and initiatives. NRCDV is a national technical assistance provider working to strengthen the capacity of programs responding to domestic violence victims and their families by promoting effective public policy, institutional response and research, and engagement and prevention. Today, through key initiatives and special projects, NRCDV works with many other organizations and partners who bring various expertises, backgrounds, and perspectives to improve community response to domestic violence and ultimately to prevent its occurrence. Now, I'd love to welcome our presenters, Edric Figueroa and Amarinthia Torres. Edric Figueroa is a queer first-generation Peruvian American born in New York and raised in Georgia who strives to build self-determination, embrace the intersections of identity, and address the structural determinants of health in his professional and personal endeavors. Through grassroots organizing and HIV prevention work in Atlanta, Edric grew resilient and connected to activists across the country. He spent 6 years in Seattle supporting LGBTQ survivors of violence, families, and youth before returning home to Georgia in 2019. He stays loving, grateful, and accountable to his values through the support of a community that stretches across coasts and borders. Amarinthia Torres is currently the Policy Advocacy Specialist at the Coalition Ending Gender-Based Violence, an organization working towards gender equity and social justice in King County, Washington. Additionally, she is a board member of the Sexual Violence Law Center, which provides holistic, trauma-informed legal assistance to victims of sexual violence. Amarinthia's professional experience over the last 18 years has been rooted in upholding the self-determination of survivors of domestic and sexual violence, as well as supporting diverse queer and trans survivors of abuse for over 9 years. Significant areas of work include survivor advocacy, support group facilitation, primary prevention, program management, grant writing, financial oversight, and training to the anti-violence field. Amarinthia's early work in the anti-sexual violence movement in the rural South informs much of her lens on patriarchy, anti-oppression, bodily autonomy, and building community. She earned a BA in sociology, anthropology with a minor in women's studies from Berry College in Rome, Georgia. After living most of her life in various small towns and cities in the rural South, Amarinthia moved to Seattle in 2010. When taking a break from the rigor of fighting patriarchy, Amarinthia is a fan of feminist comic books, bubble tea, equipment reviews from America's Test Kitchen, and watching any and all of the Planet Earth series. I'm so excited to introduce you all to Amarinthia and Edric.
Hey, everybody. Thank you so much for reading our bios, Marcy. That was really sweet. Amarinthia and Marcy and I have had the pleasure of working together on webinars like this in the past. So this is a really sweet reunion. And this is a topic that is a particular passion for me, and I know Amarinthia as well. We've both supported LGBTQ survivors, including male survivors in the past, and really feel like this topic is super rich, and just want to acknowledge that you may have seen a title floating around that said gender neutral advocacy. And on our slide set today, we were intentional about keeping that out because we think a better way of thinking of how we can support men and survivors of all genders is by thinking of gender rich advocacy. So just wanted to throw that idea as we get started and explore these terms. So
Perfect. Hey there,
I'm going
everyone.
to turn it over to Amarinthia, who's going to walk us through the of this webinar.
Perfect. Thank you so much, Edric. Thank you, Marcy. Thank you so much to the National LGBTQ Institute on IPV, as well as to the National Resource Center on Domestic Violence for giving us this opportunity to think deeply about this topic and share it with you all. As Edric mentioned, we love doing these webinars, and it is a very sweet reunion for all of us. And I'm excited to dive right into the topic. I didn't realize that y'all would be reading out the full bio. Sorry, mine was a little long. But I'm excited to share the space with everybody here and looking forward to lots of time in our webinar today for chats and comments and opportunities for input from the audience. So do please feel free to use that chat. We have lots of time built in for questions and for sharing, but feel free to do that at any time, obviously through the content. So I'm just going to get us moving. We've got a lot to share, and I want to be sure we have time for everybody's questions and for good conversation. So we thought we would just start with talking a little bit about what we're noticing as folks, as part of the LGBT community, as folks who've been doing this work for a long time. What have we noticed about the field, about this topic, about serving survivors of all genders, and why this topic? Why now? So one of the things that came to mind for me was that, working at a by and for organization that supports bi, trans, lesbian, and gay survivors of abuse, who also had a long history in the DV movement, we've had a lot of experience supporting male identified survivors of abuse, particularly men across the spectrum of gender identity and sexual orientation. So trans men, bisexual men, and gay men. And I would encourage us when we think about supporting male survivors in this topic and in the future to really think of these folks as part of who we think of when we're talking about male survivors. We've also had a lot of experience working with the larger anti-violence, domestic violence field, and have seen firsthand some of the challenges that mainstream programs were facing and continue to face in not just supporting male survivors, but supporting survivors of all genders. That could be ranging from challenges around shelter access, challenges around how you determine who is causing harm or who is surviving harm. That could be everything from how do we do a gender inclusive support group? What does that look like? So just a range of challenges from the field. And in fact, through offering training and technical assistance, and Edric and I in particular, maybe some of you have been to some of our trainings in the past. We did lots of trainings all over the country in person prior to COVID. We noticed many programs struggling to have a consistent process by which they determine who in the relationship was causing harm and who is surviving harm. And that's especially true when you can't rely on perceptions of gender to determine who is being abusive. And as a queer program, we've had a long history at doing this work of determining who's causing harm without relying on notions of gender that don't serve us and that are often rooted in patriarchy. So when we noticed so many changes over the years, we felt that in an effort for the field to be more inclusive to people of all genders, which is inevitably very good, the field has also lost sight of some of our fundamental analysis of power, especially systemic, structural, and institutional power, and how that impacts interpersonal violence. And so we've seen these tensions, and it felt like, well, you know, we noticed these things happening in the field, and so we need to talk about them. We need to talk about it with folks and put the word out there about what we've seen and what we've experienced in working with queer and trans survivors, and how that work, by centering those folks, that work can hopefully guide the field and offer some resources and best practices. And so here we are. Lots of steps in between, of course, but with that context in mind, I'd like us to focus on a couple of key questions that will guide and focus our time together. This is one of our guiding questions. How do we meaningfully support survivors of all genders? And if we were to focus in on one part of this question, to emphasize one area, where would that be? What are we noticing in the field, and what do we want to highlight? So for us, it's on this aspect of the question. It's on supporting survivors. So questions like, how do we determine who is surviving harm and who's causing it? What is our process for that, and is it consistently applied? Do we have a shared definition at our organizations about what constitutes domestic violence or coercive control? And for the most of the PowerPoint and the time together, we're going to be using a lot of language like patterns of power and control or coercive control. And we're really centering that in a lot of our experiences working with survivors of coercive control in intimate partner relationships. So we know there's lots of types of harm and violence that our community faces, and that many of you are working with survivors of a range of types of harm. And we're kind of focusing in a bit on that particular experience through a lot of the content for today. And so these questions, do we have that shared definition of what constitutes domestic violence or coercive control? If so, how do we determine who's surviving it or not when people reach out? These are questions that we think this field is struggling with, and that we hope we can offer some guidance on today. So next big guiding question, how do we maintain and strengthen a collective feminist analysis on gender, power, and violence? So again, if we were going to focus on one area of this, one area of this question that we want to center our time today, where would that be? And kind of a little PowerPoint humor here, it's the whole thing. We can't just focus on one. It's the entire kit here. So all of this is important. We want to focus on this whole area of a collective feminist analysis on gender and power and violence. So we'll come back to these themes throughout the webinar. And the next several slides are mostly just things we've noticed in this socio-political moment that we think contribute to this issue of supporting male survivors and survivors of all genders. So we won't go into too much detail on each slide because it's really more of this is what we're noticing as factors and things that contribute. I remember when the 2013 inclusive VAWA passed, I was an advocate at a by and for queer organization. And I remember how proud I felt that our community of anti-violence advocates stood so firm on behalf of Indigenous survivors, immigrant survivors, and LGBTQ survivors. This legislation increased protections for those groups and was the first time that gender identity and sexual orientation were protected under federal law. Huge effort and huge amount of power for our movement to stand firm in supporting those communities that are so on the margins and are so impacted by violence. This also meant that programs were legally prohibited from turning away LGBTQ survivors from services like traditional shelters on the basis of sexual orientation or gender identity. And this inevitably raised a lot of questions for programs about inclusion, gender, and power. Additionally, we've seen the Me Too movement demanding us to reckon with abuse of power and sexual violence at the systemic level. We've seen racial justice uprisings that are demanding us to reckon with racism and anti-Blackness within our systems and our institutions. So we're also seeing a lot of systemic focus, as it should be, on where power and abuse and violence is flourishing and where it is allowed to happen, as Tarana Burke says so wonderfully here. And we're seeing backlash to those efforts. We're seeing similar tactics of abuse play out at a much larger scale. Dominant groups who hold a lot of systemic power can often feel as though they're victimized by these changes and by these attempts to name and call out systemic power. Advocates know that sometimes people who are abusive use the language of abuse and harm to obscure their own abusive behavior, that they are the true victim of abuse, not the partner that they're with. And we're very versed in knowing that that is a tactic. And so these same tactics that serve to obscure the role of power and the actual disproportionate impact are being used across scale at a bigger level of our society as we grapple with these very big systemic problems that our communities and that our society faces. So the question we have to ask ourselves is, are we bringing our interventions to scale for the survivors that are most impacted by intimate partner violence? Additionally, there's a lot of things on this slide. Additionally, we have noticed and continue to notice a lot of impacts of the field that are showing up in how we think about who we serve, what types of supports do folks have access to, and really, I think, struggling with what constitutes domestic violence. So if we start with just the yellow box here, up here in the top left-hand corner of your screen, I think there's a lot of really much broader knowledge and language from our field, partially because of our own education and awareness about domestic violence. So things like gaslighting, emotional abuse, bipolar disorder comes up in the ways people sometimes talk about their partner, verbal abuse, triggers, trauma. There's a shorthand that's often used when folks are reaching out for support. But do we stop to ask that caller, how does gaslighting look in their specific situation or relationship? That in addition to sometimes a lack of understanding about how survivors might use violence when both people are using similar tactics on the power and control wheel, has led to us getting confused, I think, about who's surviving and who's causing harm. And that collapsing of a lot of experiences that might really range in terms of the kinds of harm or the kinds of violence that may be going on, or conflict in a relationship, can sometimes be lumped into this broader category of domestic violence. And similarly, I think we're seeing other things related to challenges related to assessing for coercive control, determining who's causing harm and who's surviving harm. So there's a lot of attempts to create a more standardized way to determine whether experiences of violence are domestic violence or whether they're not. And some of these tactics, some of these approaches, can be really faulty. They remove a lot of context in which that violence is occurring. And it can ignore the ways that patterns of violence happen over time that many of us see in our work.
Amarinthia?
Yes.
This is Marcy. We have one interpreter asking if you can speak just a bit more slow.
A bit slow. Great. Thank you for that feedback. I am a very fast talker, and it's something to definitely be mindful of. So thank you. Let's hear a little bit from you all. This is some of what we've noticed. This is some of the dynamics at play that we've been seeing in society and in our work in the field. But what have you been noticing? Are there aspects of this topic that you've been seeing play out in a systemic level, or even just things you've noticed in your work that you want to share with the group that feel like important things to note about this particular socio-political moment, and or what you've seen in the field in doing your work with domestic violence survivors as we try to support folks of all genders. And I'm going to attempt to see my chat here. I have to go to a little bit different place since I'm great. Great, thank you so much, folks. Yes, I'm seeing things around navigating a complicated relationship with law enforcement. Yes, absolutely. Making assumptions about physicality that might lead us to have biases about who's causing harm, who must be the perpetrator, or a victim would never act this way, and so this has to be someone causing harm. Some challenges here folks are sharing about, abuse against men is often not recognized by police. And I think when we'll talk more about the impacts of patriarchy and the impacts of rigid gender roles and assumptions being made around gender and who's vulnerable or victimized and who's not. So we'll have some space for that a little later on. It sounds like folks are sharing as well some difficulty and stigma sometimes around disclosure, and particularly for male survivors feeling worried about not being taken seriously or believed. And I think that's something that certainly we've seen is true for a lot of survivors, right? Around not feeling like they're going to be heard and be believed. Okay, this is great to be sharing. Thank you so much, everybody, for sharing your thoughts. It sounds like folks are mentioning some things too I'm seeing around, around the different environments that might perpetuate toxic masculinity and how that can create a culture in which setting boundaries or seeking support or being more in touch with saying no or what's not okay for you is harder because of that cultural piece, right? And that's so true for for all of us probably in some way or another in coming up through patriarchal society and trying to find our way to our own choice, to our own choices, to our own sense of self, to a gender expression that fits and works for us. A lot of redefining that can sometimes come up. Well, thank you so much, folks, for sharing this. I think for time, I want to keep us moving along, but please keep adding things into the chat. Obviously, folks attending can read the chat and participate in some discussion around this topic. But thank you so much for sharing. I'm glad I got a chance to see some of your comments. So this is just a reminder to bring us back to this goal and this theme of our time, that this large, big question is a lot of where we want to focus the next few sections of our time together. And while this is a very big question and difficult work, we already have the skills and tools we need to do this work. Much of the anti-violence movement, especially advocates of color, built this analysis and practice of connecting individual, interpersonal experiences of violence to larger systems of oppression. We have a lot of history here, and folks that we've been doing this work for a long time. So let's lean into that and know that we've done this before, and we have to stay diligent and savvy and persistent at it. So with that, I'm going to pass it over to Edric, who's going to talk us through a little bit of that content related to this big question before us.
Thank you, Amarinthia. That was a beautiful introduction, collective feminist analysis. So we're going to explore sort of our ideas of what constitutes an feminist analysis in these next few slides. So the first thing about building any type of analysis against oppression is understanding institutional inequality, and the impacts oppression has on the lived experiences of survivors. From there, we can make safety plans that actually respond to some of the systemic barriers people have. Before I keep going, I'm happy to turn off my video if the audio is a little off.
I'm not sure if folks are sharing in the chat. On my end, I've been hearing you more smoothly now since a little earlier. So it's been okay on my end.
Okay. So as Amarinthia mentioned, the recent killings of Black Americans really highlighted the disproportionate impacts, in particular Black communities. Additionally, the impacts of COVID-19 have also highlighted some of these things. We're seeing disproportionate impacts of the COVID virus in communities of color across this country. So this moment is really a reminder of the importance of centering an anti-oppressive analysis that can meaningfully engage with people of color and start from the margins. And this is particularly important for advocates because we know that people who are abusive can rely on inequality to establish and maintain abusive control. We can go to the next slide, Amarinthia. So when we're talking about abuse, we find it really important to draw intersections to oppression because the two inform each other, as Amarinthia said earlier. And one way to think about it is that we believe that abuse happens when one of us believes, and they can believe this consciously or unconsciously, that they have more value than another person. And over time, that creates a dynamic that gives that person more access to resources, decision-making power in the relationship over the other person. So the key words to me here are over time. Just like in oppression, an abusive dynamic, a pattern of coercive control does not happen overnight. It's something that is established over the course of a relationship. There's no prescribed time, of what it takes to establish a pattern, but we know that it does take some time. Similarly, no one on this webinar caused the oppressive conditions that we live under today, but all of us have a responsibility to interrupt it and to learn about how it impacts the services that we offer and the lives of the people that we're supporting. And someone who causes harm might not know that they might not have this idea that their value is more than another person, but either through surviving an abusive harm of their own, they might be causing harm from another person and inevitably spreading this message that their opinions, their time, their triggers are more important than someone else's freedom or desires. We can go to the next slide, Amarinthia. So under oppression, there's many ways to quantify and break it down, and many systems that impact the oppressive dynamics that we live in, particularly in the United States. But one that we wanted to highlight is patriarchy. And that really is a system of institutional, cultural, individual beliefs that establish a binary gender. So binary meaning something and another thing that are black and white. So in this case, it's man or woman. And under patriarchy, men are given more power and privilege at the expense of really everybody else. So women, transgender, non-binary folks. So when we talk about men in this context, we're talking about cisgender men, which is the opposite of trans. And under patriarchy, there's constantly co-created models of subordination and domination being created. So basically what that means is that for every marginalized group, there's a privileged group out there. So men, women, black, white, heterosexual, and gay people, and so on and so forth. And because patriarchy and so many of the systems that were socialized are influenced by capitalism and the impacts of this desire to put profit above all else in society, we really see these ideas being sustained by the institutions that we live in that tell us that if you buy the right product, wear the right clothes, do all the other things necessary, consume the right media, you can come a bit closer to this idea of privilege and power. So personally, I believe it's important to unpack these systems and their impacts with every survivor, because if we don't acknowledge that they exist and try to just treat everyone that we encounter the same, we're not really seeing survivors fully, and we're risking offering culturally dismissive, colorblind services. So patriarchy is just one system that we wanted to highlight as an important thing to recognize to build a feminist analysis. You can go to the next slide, Amarinthia. So how does this relate to interpersonal violence? So interpersonal violence usually belies a whole host of social conditions that are hard to quantify and qualify. For example, privilege, race, poverty, gender, oppression, resistance, wealth, cultural norms, etc. This comes from a really great article by the Crank Feminist Collective that we'll send out a little bit later in this webinar. But I found this to be especially striking with the topic of serving survivors of all genders, because it is hard to quantify and qualify the social conditions that influence interpersonal violence, but it is ever important to do when we're talking about working with marginalized folks, and when we're talking about centering survivors at the margins, as Amarinthia put it earlier, bringing our interventions to scale for the most marginalized groups in society. And by doing that, I believe we'll get closer to improving conditions for all survivors, which includes survivors of all genders. We can go to the next slide, AT. So we talked about tactics of abuse across scale. So really we can see how coercive power impacts people individually. We know that many of us have used the power and control wheel before, that has things like using isolation, using physical violence, using sexual violence to explain the lived experience of coercive control on a survivor. So we often tell survivors, it's not just one thing, it wasn't just that one incident of violence, but it was these whole other things that happened. And so many survivors have found that to be such a powerful way to connect and heal from their experiences. But when we ignore that so many of these things happen on a societal level, for example, using physical and sexual violence, this country has a long history of slavery, of colonization, in which it displaced and hurt a lot of communities of color. And if we don't acknowledge that, what we're doing is inevitably keeping an oppressive dynamic intact instead of trying to go towards it and challenge it. So these ideas that happen in abusive relationships didn't come out of nowhere. We see them across our society. Go to the next slide, 18. So I know I'm covering a lot of information and we'll have a pause for questions soon, but a couple of other things we wanted to discuss is, I'm sure by now every person on this webinar has probably seen a pyramid of power. And on those, it's usually like who holds the most power in societies at the top. People usually put white people on there, cisgender men on there, wealthy men on there, and all the other identities that we associate with having the most power in society. And then underneath it is basically everybody else. So while that pyramid might be a useful way of identifying, okay, a very, very few amount of people actually hold the wealth, the power in society, and all of us are just down here. It's very powerful at visualizing that. What it doesn't say that is important to know if we're talking about power is that every single person is capable of prejudice, abuse, and violence, regardless of how privileged or oppressed you are. However, it's only people who are closer or at the top of that pyramid that have access to institutional and cultural power and are able to back up their prejudices through policies, laws, and norms. So many of the policies, laws, and norms in this country were written to support a certain type of person, usually white folks. And similarly to say, a lot of our programs were designed to support certain types of survivors. And now, as we're looking to be more equitable, we really have to think about, are these policies serving survivors at the margins? And can we build a bottoms-up approach to serving all survivors? We can go to the next slide. So an example of ways in which dominant groups have used systems to keep their power in place is this case. So the Lesbian Mothers National Defense Fund was an organization formed to support women who were going through divorce and custody cases so that they could retain custody, or at the very least, visitation with their children. And in 1972, there wasn't a single case in which a lesbian mother had won custody. Not even just that, there was no evidence that a lesbian mother had even won visitation rights. Fast forward to 1996, there was this case in Florida where a judge gave custody of a 12-year-old girl to her father, even though he was convicted of murdering his first wife. So his first wife was a lesbian. He was convicted of, and then in this other marriage, he was with a lesbian, and he still won custody, even though he was convicted of murder. So we see clearly that while we've come some ways in society, the systems in place, I heard in the chat earlier, well, a lot of males think that the systems won't work for them if they reach out for support. Well, we still have a long ways for the systems to work for all women as well. So we can go to the next slide, AT. And if we're really talking about who is facing the most disproportionate amounts of violence in our society, we have to, of course, talk about transgender communities. Trans folks experience a number of barriers to just existing in the world. In particular, trans women of color face disproportionate amounts of homicide simply by being who they are. A useful resource is the National Center for Transgender Equality, and they have a lot of different information on here. This snippet that you see right here from their website talks about the employment barriers that a lot of trans women face, and things like harassment, physical and sexual violence should never happen on a job, but they're common occurrences for a lot of trans communities. So the question for us is, how can we respond to these disproportionalities in our work? And one way that we like to think about it is we have to make sure we're using an advocacy model to support survivors. There's many other models that different systems take to support survivors who might have survived intimate partner violence or maybe a one-time incident of violence, such as the criminal legal system. So this slide that you'll see has the advocacy model on one side and the criminal legal system on the other. We're not going to get into this slide into too much depth, but we did want to point out that in an advocacy model, what you're looking for is a pattern of coercive control when we're talking about intimate partner violence. So we're not talking about a single incidence of violence, you're talking about looking for a pattern of control that occurs 24/7, which a lot of things happen, and there's a lot of tactics that an abusive partner could use. Only some are illegal, most are legal, and importantly, they rely on systems of oppression and social inequalities to maintain their control over their partner. So with all that in mind, love to hear how this is landing for people. We can take some questions and pause right here.
Sounds like a doggy has a question in the background.
Yeah, he always has the question. Is it dinner time yet? And it's not. Well, if there are no questions, we can keep it moving, Amarinthia.
Yeah, that sounds great. And obviously we there's lovely tech support here on the webinar provided by NRCDV folks. So if there are questions, they can certainly elevate them to us throughout. So there'll be more time if things do pop up for you. Okay. Thank you so much, Edric, for that really great overview of systemic harms and how much that's connected to interpersonal violence and how much it really matters that we're really centering those folks on the margins and also really being clear about disproportionate impact, right? That data and research and who's actually experiencing disproportionate harm is so much of what systemic oppression is about at the top, in these big areas of scale, as well as what we see so much in domestic violence, right? Which is so often about inequity and disproportionate impacts in a relationship where one person has inevitably way more power and access to choices than the other. So in many ways, I think our field and advocates are so skilled at being able to draw those connections. And we just need to really be sure we're continuing that in that good tradition. So now kind of bringing us back to, we sort of started with these two guiding questions, and then we focused a bit more on some of these large collective feminist analysis of gender. And now I wanted to share a little bit more with you all about how we support survivors and focus a little bit more on this part of these guiding questions. And the next few slides are going to mostly be focusing on some of the LGBTQ Institute's approach to this topic. So we're going to be looking a bit at some of their framing and thinking and guidance on how to support survivors of all genders and some of the guideposts that we might use and reference throughout the time today. So these are a few cornerstones that we think about when we're thinking about supporting folks of all genders. And when we look to by and for programs and national organizations like the LGBTQ Institute, who have had a lot of years in doing this work. It's not a new thing to work with folks of all genders. These are things we've been doing for a long time. And so some of the things that seem like important to name and kind of hallmarks of this approach is that ideally you're setting up your program to have lots of ways for people to get support, lots of ways that recognize the range in which violence is happening so that we can focus on not just survivor supports, but also perhaps preventing harm from happening to begin with. And recognizing that at least for many by and for communities, by and for organizations that are doing this work in their community, that community engagement, community support, supporting people within this community in culturally specific way is a really important part of what it means to do thorough and meaningful advocacy in our community. And so what that's looked like is having supports and programs that are open to everyone, program that is not screened in any way, and that those spaces, those kinds of community engagement activities that are open to all are really carefully created so that they are not meant to be heavily screened. They're not meant to be only spaces where survivors are gathering. They're more meant to be information and content that's applicable to everyone. So things like maybe you want to talk with your community about healthy relationships and recognizing red flags of abuse. Those can be skills that everybody needs. Even someone who might be causing harm in their relationship may need information, good information about what abuse is like, what healthy relationships mean and look like, and that information is information everybody should have. Survivor supports, on the other hand, things like survivor-specific support groups, survivor-specific advocacy, one-on-one advocacy in that way. Those can be really important to have spaces where just survivors who have survived coercive control are accessing those supports. And that all these programs, that part of what that relies on is it relies on having a consistent process by which you're determining if in fact that person is surviving coercive control in their relationships. Because many of you probably know there are times that folks reach out to your program feeling a lot of conflict or challenges in their relationship. You may talk to them about their relationship and ask some good clarifying questions about what's going on. And it may come to find out that they may not actually be experiencing a pattern of power and control or coercive control. They may be experiencing some real incompatibility with their partner. They may be experiencing some challenges with their partner respecting their boundaries in certain situations, but they may not be experiencing that patterned nature, that 24/7 nature of domestic violence that survivor-specific support groups might be really helpful to address some of those types of experiences and concerns that we know come up through experiences of domestic violence. So it can be really important to be really clear about that particular distinction between survivor supports and open to all supports, because we know that folks who cause harm are not some other group or other people, right? We know that those folks are part of our community and they're in our community spaces, they're friends, they're family, they're people we know. And so we also don't want to be seeing those folks as disposable, but we do know that the supports that someone who's causing harm might need are going to be very different than the supports that someone who's surviving harm might need. So programs, one of the strengths I think of this approach is to really recognize that distinction and to build your programming such that you have a method by which you're determining who's causing harm, who's surviving harm, and then building some programming that allows for a range of different types of supports for people. So that way, all your programming can be still supporting all folks of all genders, but that you do have survivor-specific supports, as well as supports that are open to everybody, including folks who may be causing harm. That's a way we've seen that be successful in other culturally specific programs. And from support groups to one-on-one advocacy, we've had a lot of experience working with folks of all genders and holding space and holding difference as support group facilitators, as advocates, as community facilitator or as facilitators. We'll talk more a little later about how support group in particular can look in an advocacy model and in a model that is recognizing folks of all genders needing that support. So there will be some time later on to get more into that as we go. Similarly, our work supporting LGBTQ survivors of abuse, our own personal experiences with abuse, and all the LGBTQ advocates who came before us have really highlighted these truths over time. We know that it is not serving us well to have these binary notions of who's causing harm. Many of us may have had experiences where we've survived abuse by a woman who we've been in a relationship with. We know that these narratives that are just so limited, right, do not equate in reality. And we know that we have to be more specific about what we mean by safe space. We know that from working with folks of all genders, we know that women, we know that men can survive abuse, and we know that men can cause harm. We know that women can survive abuse, and we know that women can cause harm. And we know that folks everywhere else along the gender spectrum can be survivors of abuse and can cause abuse, can be abusive. And so we have to be more savvy about how we're determining who's causing harm. We can't rely on gender. We also can't rely on just a checklist of behaviors. Any behavior We believe, and this approach would suggest, that any behavior can be used to maintain coercive control or survive it. Even very problematic behavior, even very violent behavior, even behavior that might be on that power and control wheel. Those behaviors, if we see them showing up with someone that we're talking to who's reaching out, all those behaviors can be used to cause harm, and they can be used in the course of surviving harm. And I'm sure many of us have worked with survivors who have used behaviors that might fall on the wheel, and in fact are still surviving coercive control, and may feel a lot of shame or guilt or complicated feelings about what they had to do in order to survive, the kinds of choices that maybe they felt they had to make that weren't aligned with their values or didn't feel good for them, but seemed like the only choice they had in order to survive what might have been very dangerous, very lethal, very scary harm, and may have been a way they were surviving in that relationship. So we know that it's not about singular behaviors, right? But that pattern of coercive control over time that Edric was mentioning previously as well. Another area of the LGBTQ Institute's approach, is really looking at research and data that exists in our field about what some of the impacts and harms are when folks are experiencing domestic violence or coercive control. And so there's some research and studies that I would point people to. We're not going to go super into unpacking all the data, but they are there for you to access at a later time. But additionally, we find it's really important to look at the impacts of violence. Just as we have been talking about looking at disproportionate impacts at a systemic society level, we also feel it's important to apply that to what we know about domestic violence at the interpersonal level. And so we have to really think about who's disproportionately impacted. Coercive control is so much about inequity, about that imbalance of power. In fact, abuse is inherently, to that word, about one person holding more power over the other or at the expense of another person. And so this research shows some of these differential impacts and who's experiencing harm and what those impacts are. So significant impact was something they measured in this study, and they looked at what are some of the tangible impacts from people who've experienced rape, stalking, or physical violence by a partner. And so this is just a slide that shows how they did that and what were some of the ways that they gauged what those impacts were. And so the stat from that slide is from this National Intimate Partner in Sexual Violence survey. And so this is just giving you a little more depth into what those impacts were. So it's not so much about, this whole survey was trying to get at, not so much about someone experiencing harm or experiencing a behavior. They did a lot of data on who experienced what kinds of violence, but they also wanted to know, what are the actual impacts of that? Sometimes the impacts of that were higher for some folks, right? In having to go to the hospital because of injuries, or needing to miss days of work as a result of the violence that someone experienced. And for other folks, in their own way of self-reporting on the violence they experienced, they didn't list or name that they had these kinds of impacts. So there's disproportionate impact in the ways that violence can sometimes be experienced. And I think that tracks to a lot of people's experience in advocacy. Sometimes folks can experience the exact same behavior, but the impact on them might be very different. And so this was a way of trying to quantify that and understand what some of those impacts were. And so when we looked at that, when this survey looked at that, this is some of what emerged. And so what we want to highlight here, rather than go into all the details of the data, what we want to highlight is that we know people of all genders experience coercive control. And we know that people of all genders need support to survive the impacts of coercive control. And the impacts of coercive control and abuse are not gender neutral. So again, this takes us back to our collective understanding of power and gender and a feminist analysis of that power and gender, right? We have to be able to acknowledge the ways that gender is powered. And there is a lot of history rooted in patriarchy that we're still in the throes of. And so gender neutrality, just having things be seen as neutral, is really not serving us. And in fact, that neutrality approach really erases some of the actual disproportionate impacts that are very well documented and that many of us know exist from our work with survivors. And so actually, I think we have 2 slides in here by accident, so I'm going to skip to this one just as the better slide to use. So neutrality is not the answer. A gender neutral service model might welcome survivors of all genders, but through a lens of we don't see gender, kind of like Edric was mentioning, and we treat everyone the same. And while this may seem like the simplest solution to increase access to folks of all genders, this model really ignores power, and it ignores how gender is powered, and it ignores patriarchy. And if we don't see gender, we also don't see the disparities caused by gender oppression. And that's one of the reasons why this is a more problematic approach to trying to make services and supports more inclusive. So to say it plain, survivors need survivor supports. Instead of programs trying to fuss around with separating out, we don't serve men, or we don't serve these folks, or we only serve, we don't know how to serve gender queer people or non-binary people. Some of these rules that have been created that have so much to do with separating people based on perceptions of gender or based on sex really miss the point, right? The filter we should be looking at to understand or set up our supports around is actually around survivors, and really ensuring that we are supporting survivors in our work. And that's where some of what we've noticed the field struggle with is around this piece of determining who's causing harm and who's surviving harm. And in an effort to be inclusive to everybody, we find that programs are sometimes skipping a few steps before they've really determined, is this person surviving coercive control and domestic violence? And so obviously, as we said, the supports are very different that someone might need depending on what's happening in their relationship history. And so we have to be really clear about what those are before we can be in a position to suggest to folks, here's what you need a survivor support group, right? And so we're going to talk a little more actually about how are we setting up those services in our intake processes, or how are we determining, is somebody causing harm or surviving harm? Because it can be very complicated and complex. And so that's a little bit of the direction we're headed as we get into talking about advocacy and talking about how we actually do ensure that we're supporting survivors of domestic violence. So that was also a lot of information. As we said, we wanted to make sure there were places to pause and have questions or engage, and do our best to answer your questions in the moment as we can.
Amarinthia, there's a question from the chat that asks, what are some good resources to learn more? This is a bit back, bit earlier in the chat, but.
Well, I mean, a easy one that comes to mind is a little more self-promotional, I guess, in that Edric and I both just worked with NRCDV and the LGBTQ Institute to write up some documents on this very topic. And we have their TA question of the month is something that they offer to the field. And we wrote the TA question of the month for both May and June. So there's one that's already out and hot off the presses that folks can check out to read more of our thoughts on this topic. And then there's a second one that's a follow-up that will be released very soon in June. It's June now, but it'll be out there very soon, a couple weeks probably. So those are a couple. I would say one book that I consistently find helpful to this conversation has been some of the older writings from some of the queer and LGBT ancestors, or like forethinkers, people in the field that have put forward so much guidance and brilliance to these topics. So one that comes to mind is Homophobia, A Weapon of Sexism by Suzanne Farr, and that's Pharr. Has some things that are a little dated. It's written from back in the 80s, I think, 70s, 80s, but really has a great way of drawing intersections between sexism as the primary source of where so much homophobia and rigid gender comes from. And I think it's a great resource. I've also particularly enjoyed reading, it can be kind of dense, but I know Conflict is Not Abuse is another great book that I've learned a lot from in this topic as well. Those are a few of my thoughts, but maybe there's more questions popping up in the chat too, so I may pause and see where we're at. Edric, did you have any thoughts on that too?
There were some questions that I think would be good to address right now. There was one that said, how do we be mindful of the safe space moniker if a survivor associates their violence with gender? How you suggest keeping those biases out of the safe space, but also being mindful of triggers? And if I may, I would love to turn this question back to some of our advocates on here and just ask, like, how do you all respond to triggers in general when they come up? Because I think that is something that we all probably have some experience with, even if it's not particularly around this idea that, if I read that correctly, having a male in a program or support group would be triggering. Also welcome your thoughts on that question, Amarinthia, but thought it would be a good opportunity for sharing.
I think that's great. Yeah, what do people think? I'm going to go back and try to find the question too, so I can think on it as well.
Yeah, so how do you support a survivor that's been triggered in your advocacy, in your support groups, or other program? What are some things, lessons from y'all?
I see.
Meet them where they are, just be present. I think that's great. Be open to what they would like to say or talk. Deep breathing is the best. Yeah, I think there's probably a lot of different exercises that are either around active listening, breathing, or grounding. Lots of times you can take a break, step out, talk it out with people. So those are all great things when it happens in the moment. Safety, keeping the lime on the desk is a creative idea. So there's a lot of great ideas coming in the chat, and depending on your capacity, I think the answer is going to be different. But one thing that came to mind that we'll talk about a little bit later, we can just go through right now, is that we can be intentional around what our supports and groups look like, and really have those conversations about, this is what the group looks like. Is it going to be triggering for you? Because so often we'll have groups of the same gender, or even the same identity, and there are still things people say, things people do that act as a trigger for other people. So if we just see this as an additional layer to that we can actually plan for, and some survivors might not be ready. They might not be ready to enter a mixed gender group, and we can honor the self-determination and hopefully have options. It doesn't have to be either or. Anything that you would respond to that, Amarinthia?
Yeah, I was thinking a lot about, and when I went back and looked at the question, I think so much of what that speaks to is the challenges that can come from holding space of survivors when there are so many differences. Because many of us have probably, if we take gender out of it for a second, not that you can ever really take gender out of anything, but if we try to put it aside for a split second, many of us have probably facilitated support groups where people might be triggered by another person's experience around abuse, and that there's triggering happening of a group in a group of survivors for a range of reasons that may not have to do with the gender of that person bringing up trauma related to the fact that they share a same gender as the person who was abusive to them. And so I would say it's similar in how we might navigate that. I remember having to navigate this in a group setting at one point where someone felt really soothed by essential oils and scent-based, lavender scents or things like that in group to be able to bring themselves back and be present. And someone else felt really triggered by that and had a lot of sensitivity to that, and there was conflict in the group, and so we had to sort out together as a group, okay, how do we want to balance these two needs of the group, and really speaking back to the group and having group agreements that you can lean on. I think also what came to mind for me was sometimes I think as a field I think that there's a tendency to sometimes feel as though someone is triggered, and so we have to do everything we can to try to avoid that trigger in the future, or make safe space so that the trigger can ease or subside. And I don't think that that's a bad approach necessarily, but a lot of our advocacy with LGBT survivors was really recognizing that making a survivor's world smaller and smaller and smaller by avoiding trigger after trigger after trigger is not exactly a robust and it's not exactly a robust life full of agency, right? Like, we want folks to have choices about how they respond and react. And when someone is triggered, there's actually a lot of choices that they have about how to respond or move forward, or how they want to take care of themselves and what they might need in response to that trigger. So I think some of it's also for us to remember that we don't have to get frozen as well, or stuck in just the trigger occurring. We don't have to promote ideas of just trying to avoid every possible trigger that may emerge, because that inevitably doesn't give survivors a lot of skills for how to move through a trigger and get on the other side of it, where you can say, okay, here's this trigger, there it is. How do I want to move through it and try to actually have that trigger be less of an impact to me over time, to where it's not so ever present. And I think that that's something we as a field have a lot of good experience with, but also sometimes I think struggle to, when we have these conflicting triggers, right, amongst survivors. I think we can sometimes struggle with that. Yes, those are a few of my thoughts.
Yeah, that was very well put. I think it's important to remember that we can't live in a world that's not going to trigger us. But we can work towards dealing with our triggers and help survivors through their own process and acknowledge that what they're feeling is real. There was another question around how this idea of inviting all genders into a shelter might work. And I think that's a much more complicated conversation that we don't have time to today, but some of the ways in which built environment contributes to the gender dynamics of shelter are something to consider. I know that a lot of programs out there don't have money to do a housing first model of shelter where everyone gets their own private room. And that for those shelters, it's probably much easier to say, here's rooms for whatever gender you are. For communal shelter, probably a lot different. But was there anything that you wanted to add before we move forward, Amarinthia, to that question?
I don't think so. I think that I would just say that there's plenty of, I would say that this model can absolutely, I believe it can absolutely work within a shelter-based model, within a shelter. And it's true that there's, the built environment creates some real challenges. for queer people, and also we've seen in our experience for lots of folks, right? Sharing communal space with a bunch of strangers, you know, where you're trying to navigate kitchens and cooking and bathrooms and limited space, and where everyone is very at a very difficult, maybe one of the most difficult times in their lives, and you're trying to add in all of these factors in this shared environment, means a lot of need for creative thinking and problem solving in real time. And you know, we have really benefited in our advocacy from programs that do have some of this, DV housing first model or scattered site model, where folks have private room in a hotel or in an apartment complex as part of the program. But there's actually great resources we can send out that speak to some of this built environment piece. So we can certainly send that out to folks so you can follow up, since we're maybe don't have all full time to address it fully.
Yeah, I'm loving all the questions and comments in the chat. We're learning from each other, which is all we can hope for when you do a webinar. Amarinthia has some real-time planning, switching things up, because some of these questions are around the service provision. What if I just introduce what an assessment tool is, and then we just go straight ahead into the last section of the webinar?
I think that's great. Yeah, let's make some changes. Yeah,
so
perfect.
Where
should we skip to?
We can skip to the assessment tool, the one that says there's no simple formula.
Great. We're going to skip ahead, folks. You will, I think, get all the slides, so you have plenty of time to follow back up for the things we're missing. Just a few slides there.
Yeah, and I'll just touch on this slide for a second before we move forward. So we know that there's no simple formula to determine, and that we need a strong framework intake process rooted in understanding oppression, but also discerning for patterns of control, looking for that coercive control in a relationship. So this idea of gender-rich services is not possible for gender-rich survivor-specific, rather, services is not possible without something like an assessment process in place, something that can look at, all right, here's all the things that are going on in the relationship, here are the dynamics of both or all parties involved, and here's who we think is surviving based on this information that we've collected from directly talking to survivors. This is not an assessment training, so we're not going to go into, we had a little bit of an overview, but we're just going to skip ahead to the last section because I think it's more relevant to the questions here. But that is to say, we will have another TAQ on this topic published a little bit later, I think maybe even next week. So we'll make sure that webinar attendees get a link to that, because it does talk about what an assessment process is and why it is important if we're talking about serving men and serving all survivors. But let's skip ahead to slide 44. Or the next one.
I'm sorry. Yep, I think the numbers got a little off.
Oh, it's 45, yeah. Yeah, so maybe in this section we can talk about this neutrality. If you want to start with that, 18, I can turn it back to you.
Okay, perfect. Yeah, great. So do you mean, sorry, Edric, do you mean this chat question?
Yeah, we could start with that chat question. I was also thinking we could respond to Katie's question about how we naturally neutrality in services.
Yes, I see.
Well, not services.
Perfect.
Yeah.
In the chat, perfect. Sorry, I did not have the chat fully up since I'm sharing screen. So let me see. Thanks everybody for hanging in there with us. Yes, okay. How do you propose not creating neutrality in services while also not segregating services based on identity? Yes, this is a great question. Is the idea to address difference of impact in the group with all participants? This is really great. Yes, I think this is a really good point, because there can be, there absolutely can be a benefit to some spaces being very aligned or connected with a shared identity. I think there's a lot of value at times that folks get out of spaces in which there is a common a common identity shared. And in particular, I think that that is really, can be really important, particularly amongst marginalized groups. So, identity-based shared spaces, whether that is like a yoga event for folks of color only, or spaces where Black folks can come together and share about their experiences as Black people in society that is very anti-Black, can be really meaningful and profoundly important spaces to have. I think we've found, so I just want to say that kind of up front. I think, Edric, you've talked about this in such a lovely way, I feel like, around really, really asking the question of whose needs are being prioritized in decisions around doing segregated services or supports. And I don't know if you want to speak any more to that about it, Edric, but I think in terms of services to survivors in our field, in the anti-violence field, I'm a big fan of, I'm actually a really big fan of the mixed groups, as assuming you can determine that folks are survivors, that you can go through the process of ensuring that everybody in there has survived violence and has a shared similar experience of surviving in their relationship. Whether that group is made up of, male identified folks, lesbians, queer folks, genderqueer folks, trans folks, different ages, different religions, different backgrounds, all the ways that survivors are so diverse in their lived experiences, that actually seeing those differences, but also seeing how similar people's experiences often are in surviving violence, is hugely profound in people's lives and in interrupting some of the biases that we can have around people of different identities than us. And at least in queer community, that every community has struggles around bias or perceptions or assumptions they're making about another group member. And so even in a queer specific group, you just saw really beautiful connections being made across very big differences in gender identity and sexual orientation. And I imagine that's a similar experience maybe people have had if you've done groups that are bringing together folks of a lot of difference. But the central piece has to be that you are determining that they are surviving, so that in their relationship, so that shared identity is what's bringing people together. Otherwise, I think it can get very complicated and can start to feel like less of a safe space, quote unquote. I don't know if that quite speaks to the question. Edric, did you have something else to add?
Yeah, I think you hit it right on the head. Like, are you segregating your services to build solidarity? There's always going to be a need for culturally specific programs, just because that's the way oppression works. But if we're trying to say this is for survivors, then simply saying, well, we don't know how to deal with this because they're men calling, or we don't want people to be triggered, it's not actually serving survivors' growth or our growth as advocates. And I think these things are muscles that if we lean towards our discomfort, we can get more comfortable and grow our skills with it. And also, everybody has to work within their own cultural limits. So really understanding your community and understanding what's going to land and what's not are important, but also not being afraid to take risks. Praxis, right? Give yourself permission to try something. If it doesn't work, try something different.
Mm-hmm. Just since we were right on it, I just went ahead and skipped through to this section on creating structures of difference. And if we have time, we can also go back to the other ones, but we've been talking more about group and difference, and so this felt right on point. We can always go back to the more one-on-one advocacy piece a little later if we have time.
Mm-hmm. Yeah, exactly. We're creating our structures for difference, meaning that we're embracing people's intersections of identity in our supports. And there's many ways to do that. In our built environment, like we said a little bit earlier, letting people know up front what our supports look like. That includes sharing values, whether your support group is based in a religious background or an anti-oppression context, all that information is important to know because it's going to influence the support that you offer. And the way that we've done support groups is always making sure that our agreements spoke directly towards having an expectation that will respect identities and redirect or correct comments that are harmful, that recreate racism, sexism, transphobia, or other isms. All of those things are just some simple ways to create structures for difference. Anything you want to add, Amarinthia?
No, I think that was great. Yeah. Yeah. And being okay with just knowing like conflict might come up, and, you know, that structure can also help with some of the concerns folks had around when folks are triggered or when they're activated in some way, even if not a full on, you know, physiological response to the trigger. You know, having that consistent structure has been really helpful, and making space for the difference that may emerge, and putting that as a regular part of your time, so that it's not like, oh, now there's a conflict around difference, we have to do some separate different processing group. You create space for it in just as part of your outline of, you know, every week's group is how we did it anyway. That way it's not unusual, it's not, you know, something like an add-on structure that has to happen because someone did something wrong. You know, so much of how we've seen conflict, and particularly for survivors, you know, so much of how conflict has emerged has been in an abusive way, right? So part of that group is to rebuild and rename and kind of repair our association with conflict. That you can have normal conflict in a relationship or in a space and disagreements, and it's okay. You know, it doesn't have to be scary or abusive, but it can be confusing if you've had an abuse history. So, yeah.
Yeah, I love, this reminds me of that slide that you had. That's like women's space equals, does not automatically equal safe space or brave space. And even in identity-based spaces with just queer people or just queer Latinos, there is still lots of conflict. And I would say identity-based space does not equate values-based space. And when there's a values difference, which, you know, all of us are raised with different values, there is going to be conflict. So
that's a great point. Yeah, we can't just, that can sometimes be a very, a bummer feeling, you know, if you hope that there are values alignment in an identity space that's shared. Sometimes that can be a bit of a rude awakening.
yes, this is an example of what Amarinthia was talking about around how we built in conflict in the support group that we ran at a By and For organization. We intentionally had time to bring up old business. So you'll see that as a regular agenda item. Every support group just had time for us to reflect on the last ones. And in particular, we welcomed participants to say, something triggered me last week and here's why, and either go directly towards it with the person who made the statement or with us in a respectful way. It was also a time for facilitators to model things like, we introduced a topic last week that we couldn't really facilitate in a meaningful way, and we know we left people feeling triggered. So that type of having a structure in place that models the ideas and the ways that we believe we should be showing up as survivors, as people existing in an imperfect world, were really helpful. It was really helpful just to have the structure for it. And because we were by and for, we also had a little piece in our ground rules. It's a little hard to read on here, but we also made it clear that we expect people who are coming to group to let us know if they're starting to date, and we can make a plan about whether they should both be in group if that was going to happen, or whether one of them needed to step aside. But they could of course be friends. Facilitators and participants couldn't, and they could, you know, they were adults, they could live their lives, but we expected some transparency around what was going on in their outside relationships, because that certainly was going to impact the groups. So ways in which you can include queer people and people of all genders in your group.
Edric, quick little check-in question. Do we want to go to the chat question, do you think, around what support folks might need further? Or do we want to go back to, because we have a little bit of time still left, folks, and we're just trying to see how we want to wrap up for today.
Yeah, thank you for hanging in there with us. I think it makes sense to just take any last questions, and we can introduce this last question as if people want to respond to it, but really anything that is coming to your mind. I know we only have a few minutes left. We're around for a few minutes afterwards if need be. So don't be shy with those questions. So what areas do you or your program need more support in welcoming folks of all genders? This could be your homework to think about if you don't ask it now.
Great stuff in the chat too, just catching up here. Yes, leaning towards for discomforts. And thank you, Megan. I'm so glad that it's resonating for everybody. Or for you. Yes, Victoria, talk about a whole topic of another webinar, perhaps. More help not modeling performative activism. Yes, I think there's a lot of that can happen that sometimes leaves not enough room for just real learning and recognizing that we all are learning and have a lot to unlearn, and more relational connections rather than sort of more performative way of some of that can be really tricky and difficult. And don't get me started on social media, but I think that's a big part of the problem. I'll leave it there.
Yeah, that's a great thing, because it's performative activism. Like, it's not just enough to have we accept people of all genders or queer folks. Ongoing training is going to be a key component of working with any diverse community, that I hope that there are other resources for technical assistance.
Yes, thank you, Anne. I think one of the nice parts about wrapping with this question is that, obviously NRCDV and the LGBTQ Institute can see this as well and guide some of the resources your way if they exist, or can focus more time on following up with some of these areas. I think helping with shelter policies and really thinking about that shared space dynamic and just how hard it can be for shelter advocates to navigate all of the needs that survivors have in this communal way, and the way that brings up questions around inclusion and difference. I think so really is an area that I know when we've done trainings or TA to folks in a shelter-based program, there's just so much richness there and complication. It can be a very hard and complicated approach. It just maybe not complicated, but just like there's definitely a need for a lot of creative thinking, leadership, and a clear sense of purpose to sometimes make hard changes that may need to happen for that broader goal of inclusion. That's great to hear. Any other last thoughts or questions folks have in the chat about any of the content today or anything that's been shared thus far?
Awesome. Thank you everybody for joining today's session. We're super excited that everyone was able to make it. Please be sure to respond to our brief survey as you log out. It means a lot for us to get that feedback. Thank you. Thank you to our wonderful presenters. Thank you to our interpreters, our translators. We all appreciate everybody for contributing to this session. Thanks, everyone.
Thank you so much. Really great to engage with everyone.
Yeah, thank you, our CDV, for letting us do this today.
Yeah. Have a good rest of your week, everybody.
Thank you for sharing your time, your energy, and your work with us today. I hope you were able to take something away from today's training. If you have resources that relate to this training, or if there's a topic you would like a future training on, please share in the comments below. You can find more information and links to resources for this webinar in the description below. And as always, like and subscribe to our channel for more videos.